Thank you, Mr. Speaker. Colleagues, I am pleased to present House Bill 4045A for your consideration. This bill comes to us with unanimous House healthcare vote and near unanimous support, save one, in Joint Ways and Means. Since the start of the pandemic, Oregon has seen a rise in community violence. These problems are not intractable. There are programs that have been shown to lower violence. As a physician, I particularly admire evidence-based interventions, including those that interrupt the cycle of trauma and violence. House Bill 4045A would expand such an intervention. You see, victims of community violence often return to environments where there is pressure and motivation to retaliate. Trauma increases the likelihood of perpetuating violence against others, and studies have shown that almost half of the victims of community violence will become injured again. And for 20%, that second injury will prove fatal. Fortunately, timely intervention can interrupt this cycle of violence, and House Bill 4045A supports an important one: hospital-based violence intervention programs. Here's how it works. When a victim of community violence arrives in a hospital emergency room and is deemed to be high risk, an on-call community member is summoned. They intervene during this golden moment immediately after injury, when evidence shows that people are most likely to seek change. These community members are trained specialists with lived experience who engage and work with the victim for 6 to 18 months after the injury, helping with their physical and emotional recovery, as well as providing other supports like helping with resources such as job training and housing. These folks provide concrete solutions for the victims to escape the cycle of retaliation and to prevent future injury and even death. And now the numbers, the evidence. Individuals who receive such interventions are more likely to utilize preventative services and are less likely to be arrested after injury. One study showed the use of violence prevention providers, as described above, reduces violent re-injury by 50%. So the first part of House Bill 4045A provides funds to such programs, including $4 million to Healing Hurt People and other existing hospital violence interruption programs to grow capacity, and $1 million for the startup of community-based organizations and hospital partnerships across the state. The second part of House Bill 4045A works to provide long-term stable funding to this work. It will professionalize and certify community member specialists who are the soul of these intervention programs. Oregon will then seek Medicaid reimbursement for the program, harnessing considerable federal matching dollars to aid victims and to curb community violence. Like so many other bills we've discussed this session, this is the best of both worlds, providing tangible assistance now to people doing the work in order to address our rising community violence, while expanding that work and also putting in motion the framework to provide long-term stable funding, including accessing significant federal match dollars as soon as next year. These investments today will save lives and yield long-term cost savings. As you can imagine, House Bill 4045A enjoys the support of a wide variety of medical professionals, community-based organizations, coordinated care organizations, hospitals, and you, Oregon legislators. Colleagues, as we seek to improve community safety, I strongly urge your aye vote to invest in programs that work. Thank you.